it's really important for dentists to know that there's other options out there as opposed to removing teeth. Hi, my name is Al Borromeo, and I'm a third-generation dentist. I've been practicing for 32 years, graduated in Loma Linda. My grandfather was an American soldier from Memphis, Tennessee. Saw this lady selling bananas and married her. So here I am. I like to talk about dentistry only because that's our field, and I really enjoy the new concepts in dentistry, which Dr. Tanner, I think, has something that's really revolutionizing the thing that's happening with palatal expansions to maximize the airway. And if you do a lot of research with airway and sleep apnea and all that, Stanford and Harvard has this thing where, when you have more airway, when you're breathing through your nose, you get more nitric oxide. And it's just really neat to have that. It changes your attitude. You get more refreshed. It's like you have more energy, and life is about energy. Well, actually, what it is that it's a very simple procedure. We take impressions, and what we do is we don't really tip the teeth. With orthodontics, regular orthodontics, it's tipping of the teeth. What Dr. Tanner is doing is actually expanding the palate to have more airway. And it's really amazing because there's testimonials with my patients that are saying, they breathe better and you have more space for the tongue also. Yes, we do myofunctional therapy. We talk about that with our patients before we start, if there are habits or all the other stuff. But it's really important for dentists to know that there's other options out there as opposed to removing teeth. Even class 3s where there's doing surgery. It's almost criminal actually to cut the jaw and pull the jaw back. We've had lots of cases already which I thought would need surgery, but when we did the expansion where we did the jaw went back and it's on alignment without the surgery, and patients were ecstatic about that. That's something that a lot of us dentists don't know about. So I would like to if you could just talk to Dr. Tanner about what his appliance can do. It is a neat thing to just have a little bit of another option as opposed to surgery. With children, it's really amazing. So, with children, it's a no-brainer. It actually is a very simple procedure. We take the impression and I send it over to Dr. Tanner. He does the lab work, and it comes in and I make some adjustments to make sure that it fits. When I have him bite down, I have this articulating paper and I make sure that the canines have a little bit of leeway in there, and I grind the back portion of it and make sure the bite's good. And more than anything, telling the patients that sometimes they're going to salivate a little bit more, and that we're all creatures of habit, and sometimes you feel like, oh gosh, I can't tolerate this. You might wear it for a few hours, then increase it, but more than anything, it's just getting used to the appliance. But it's a very simple appliance to do. I mean, if you're a general dentist, I think that if you just try one case. You start with a crowded teeth with air issues with a child that's having apnea episodes, and then you expand the palate. The other option is could you picture children using a CPAP? It's just, so I tried this option because I myself have severe sleep apnea. So I had that, we increased my bite. I did the oral appliance and it stopped my snoring. I wake up refreshed, and it's I think that it really works. The other option is to have the CPAP machine, which I think isn't sexy. So the appliance is actually easy. Just try it out. Sometimes you just have to get in the water and then you can start swimming. Because we could talk all about the appliance, but until you have just have one free case and just do it so you can get familiar with adjustments, and more than anything is patient education, to let them know that you don't have to freak out. It's an easy thing. You can take it off and you can put it back on. But they can see the changes once you start that movement, and make sure too that they turn the key the right way. I had one patient that was, nothing's happening here because it was turned the wrong way. Make sure that the instructions are detailed, and they got this recall to where you can see them, and you can see the appliance, and you'll see the amount of expansion. And patients are thrilled by it, adults and parents.